Welcome to RSSDI TV 2020. I am Dr. Shahu Ingule and you are watching me on RSSDI TV brought to you by Wockhardt. Today I am honored to have with me an eminent personality and renowned senior diabetologist, Dr. Bharat Saboo sir. Sir is the diabetologist, Prayas Diabetes Center, Indore. Welcome to the show, sir.
Thank you. Thank you, Shaw.
So, sir, we'd like to know based on your recent talk in RSSDI, do you think that there is a clinical inertia among the practitioners and also among the patient for the early insulin initiation and intensification? And what is the current trend in central India?
Look, Shaw, you touched the right topic actually. There is a lot of clinical inertia as far as doctors are concerned because we recently did a survey for this symposium, which I would be talking as a part of it. And we found that I mean, our colleagues and doctors delay insulinization by waiting for up to 3 OADs. And the figure which came out was around the HbA1c was 9.3 when the insulin was initiated. So it's a delay as far as all the clinical guidelines are concerned. But the biggest factor for this was the clinical inertia, which amounts due to the fear of losing patient, which came out with our survey, that most of the doctors think that they will lose their patient if they start insulin. So this was the biggest thing which came out.
So, sir, what do you think? What efforts should be taken by the practitioners to overcome this clinical inertia?
Look, it's a multifactorial effort. For clinician and for you as well, because I think you are the spreader of knowledge for doctors and as well as the general care people who are there. So pharma people can come up. Then we have our support staff, educators, nurses, and through the help of whatever means we can, because these days social media is also very popular. We should teach our patient that insulin is not a harm to them. It is rather a blessing. So people should not consider themselves to be sinned by getting insulinized. Because the trend which has come out is that patients think that they have done some sin, and that's why they have been prescribed insulin. So that what prevents doctor from prescribing insulin. In our survey, we found that almost most of the doctors, 80-90% of the doctors know what the guidelines are. It is not like that they don't know where to start, when to start, how to start. The only problem is not accepting the need of the patient due to the fear of losing patient. So this is an interesting aspect which has come up.
So recently, sir, we celebrated World Diabetes Day on 14th of November, wherein the theme of this year's Diabetes Day was the nurses and the diabetes. And if you look at the last year's World Diabetes Day, it was family. So what do you think that these two particular groups, the nurses and the relatives of the patient, play a significant role as far as the insulin initiation is concerned?
Look, as we all know, you and me will agree that diabetes is a multifactorial disease in terms of pathogenesis, effect on body, and in terms of support staff and supportive things as well. So there is a huge need. I would say there are things which are going up and which are coming up, but there is a huge need from families also, from the caregivers in the home. They need to be educated about the right and wrongs of insulin therapy, because once they are educated, they will be better able to convince our patient. Because what happens, most of our patients who need insulinizations are geriatric old patients. So they more rely on their pillar in the family, what I call them a pillar. Uh, if I call in local dialect, हर अम्मा और हर दादा का एक खास आदमी होता है घर में, चाहे वो पोता हो, चाहे वो उनका छोटा बेटा हो, या एक खास आदमी होता है. तो I always talk to them and I always tell them कि वो आपका खास आदमी कौन है जिससे आप सारी बातें करते हो. Then I counsel that खास आदमी. If you counsel that person, I think insulinization becomes very easy. It is sustained then, because then they accept. Because if you and me can say something, it will, I think, will not be absorbed. But if their grandchildren are saying the same thing, they will take it easily. So this is the role of family actually which is there. Now come to the second part, which is the integral component, the support staff, nurses and all those things. And in India, unfortunately, we are lacking in this. I have seen in UK and in US as well, they have a whole set of team which is running after the patient, and they are taking frequent feedbacks. They are solving their queries. They act as a bridge between the caregiver, doctor, and the patient. So that eases out the burden on the doctor as well, because you all know it is not easy to pick every phone call and to respond to every query by yourself when 90% of the queries are soft queries like what can I eat, what not to eat, whether I can go, whether I should not go. So these sort of queries plus the basic insulin related, pen related issues, site related issues can be taken care of by nurses. So that will ease out the burden like anything from the doctors. So they will be more prompted to insulinize patients because most of the doctors, they don't, in our survey we have found that they don't have a support staff with them. They need to counsel themselves, they need to take care of the patient after insulinization themselves. So it becomes tedious, and when it becomes tedious, a doctor becomes averted. So I think they will be better suited if we can incorporate one caregiver in the form of nurse and midwife, and we can train them to the fullest level with the doctor. So it will act as a bridge between the doctor and the patient, and it will work wonderfully well.
Okay, so thank you so much, sir, for sharing your views and joining us on RSSDI TV brought to you by Wockhardt. Thank you so much.
Thank you. Thanks a lot. Stay safe. Thank you.
Thanks, sir.